Now, joining me now to talk about all this, Roger Hickey. He's the co-director of the Campaign for America's Future. Glenn Hubbard is Governor Romney's chief economic advisor. Mr. Hubbard, all fine sentiments there, but the devil's in the details. I'm rather curious about why Governor Romney has universal health care in Massachusetts, but it seems to be absent from this plan. Can you explain that?
Well, I think what Governor Romney has done very helpfully is say, look, to make private markets work, you have to make changes on both the supply side to make insurance affordable and on the demand side so that people can buy it. If you do those things and you let states experiment, you will get people covered.
But Governor Romney is quite proud of the fact, justly so, that he has a universal health care plan in Massachusetts, but those elements seem to be lacking in the plan he has for the United States. Is there a reason it does not translate well for some reason?
Well, first, I don't think your statement's accurate. What his plan involves is a lot of state experimentation. Massachusetts did one thing, and he's justifiably very proud of it. Other states may do something different. The question on universal coverage is really getting people into private insurance at reasonable prices, and this plan will do that.
Roger Hickey, I know the Democrats are very big about talking about taking on the big insurance companies, the big health care companies. Not much of that in this plan, but maybe some in the other plans. Senator Clinton, of course, unveiling plans as well.
Well, yes, and that's, you know, if Mitt Romney's proposals, his new ones, running away from his track record in Massachusetts, were tried, we'd have something like George W. Bush's stalemate in the last 8 years. Bush wanted to cut taxes to get people to buy their own health insurance and undermine the employer-based system. Mitt Romney would do the same. There's not much new here, and certainly you're right. He does not take on the drug industry or the insurance industry, which have been driving up prices not only for individuals but for corporations. You know, Hillary Clinton made a speech today, and it's notable that the National Association of Manufacturers came out in support, praising her proposals for more efficiency and more quality in the healthcare system. These prices are killing the business community.
Mr. Hubbard, is this the retread of President Bush's plan?
Not at all. I mean, it's hard to know where to even begin with Mr. Hickey's comments. I mean, what this is a continuation of about 30 years of conservative thinking in health care, embracing what Governor Romney himself did in Massachusetts. There are two keys here. One is federalism, letting states experiment, and second, to make sure that we make markets work. That's the clear difference between what Governor Romney has proposed and the expansions of government plans that his Democratic opponents have proposed.
What's wrong, Mr. Hickey, with more privatization of the healthcare business? We do have a system in the United States where you can get needed operations if you need to get into it. Do we need to dismantle that, or is there something wrong with the system the way it is?
We have a healthcare system that's been shaped by many, many decades of Republican and conservative philosophy, where the insurance companies have been in charge. Now, in Massachusetts, Governor Romney tried to take on the insurance companies a little bit and create some standards, but he's kowtowing to the right wing of the Republican Party. The Cato Institute praised his plan today because he's not instituting the kinds of things that he did in Massachusetts. He's simply saying tax cuts and, as you say, deregulating the private healthcare system will somehow insure the people that are uninsured and somehow improve a very badly functioning healthcare system that many people who think they're insured no longer have insurance when they are sick. So we're going to have a real debate about this in the coming year, and millions and millions of people are going to be asking tough questions about Mr. Romney's health care plan.
Mr. Hubbard, let me just get your response to Senator Clinton's health care plan. I mean, the National Association of Manufacturers endorsement is certainly interesting. They're looking, obviously, for cheaper, more cost-effective health insurance for their people that's out there. What is it that they see in Senator Clinton's plan that's appealing to them, and where are they misguided or misinformed?
Well, I think there's a temptation for many, including some business leaders, to wish that health care burdens could be borne by, quote, the government. But of course, the government is all of us as taxpayers. What we need to do is make health care markets work better. And that's not the somehow that Mr. Hickey proposed. It's economics. It's getting the plans available at reasonable prices. Governor Romney's plan does that.
All right, we're going to get into politics next. Our guests are staying with us. They're not going away. How will what's going on in the markets and the economy shape the presidential race in 2008? We're back with Roger Hickey, the co-director of the Campaign for America's Future, and Glenn Hubbard, Governor Romney's chief economic advisor. Mr. Hickey, we heard Senator Clinton there talking about the need for a better balance. When Republicans hear that, they think tax increases, and there's been some noises from the Democrats, let's be blunt about it, about the possibility of perhaps raising the maximum tax rate from 35% maybe to as much as 45%. Do we need to do that, and what is the rationale behind it?
Well, just as in health care, we're going to have a real debate about the economy. And we've had the Bush administration basically cutting taxes for the wealthy and not providing much in the way of services. So some candidates may be talking about rolling back the top end of the Bush tax cuts to fund things like health care for all. We're going to have a real debate in this country over the next couple of a year or so about the direction of our country and who ought to benefit from government policy.
Mr. Hubbard, should we be increasing taxes on the wealthy to help fund the health care system?
Well, the first thing is to step back to your question and ask about the sources of economic growth. The sources of economic growth in this economy have been entrepreneurship and innovation. I think it would be a big mistake to raise taxes on the most productive individuals in our economy and to raise taxes on capital. We really have two fiscal questions in the country. One is, what are we going to do to rein in long-term spending? And two, how could we do tax reform to make sure that we have the right balance of taxes in the country? That's what's needed.
Well, you know, that's the debate here. We are discovering that an unhealthy populace is not very productive. We're discovering that when you have bridges falling apart for lack of investment, you have a very unproductive economy. So there's going to be a real debate about whether tax cutting that benefits the wealthy really benefits the rest of us. That's going to be what we talk about.
Mr. Hubbard, are Republican candidates talking about more tax cuts? Are Republican candidates talking about it?
I hate to rain on that parade, but this economy has been the economy that has been the productivity growth miracle over the past decade. We just can't misrepresent the facts.
Are Republicans candidates talking about cutting taxes at this point, Mr. Hubbard, though? Is there anybody out there right now who's arguing that point?
I think you will see the major Republican candidates with very significant tax proposals that will be tax reform and cutting some taxes. Yes, I think that's quite likely.
Yes, because they're all competing to be the next Ronald Reagan when the American people have realized that Ronald Reagan and George Bush left us ill-equipped to compete in the global economy.
Let me just ask you very quickly, we only have 30 seconds left, about regulation of the capital markets at this point. Of course, there's a lot of concern about the credit crisis that we've had, but Mr. Hubbard and Mr. Hickey, do either of you think that we need more or less regulation of the capital markets right now?
I think we need a more balanced regulation of our capital markets. It's not really a matter of more or less. Our capital markets have been part of what has made us the growth miracle over that period in which Mr. Hickey suggested we were distressed.
I'm just going to have to stop you. We're out of time. We've got to get going. But thanks very much for coming by. Roger Hickey and Glenn